Right, my name is Biobele Brown. I am a lecturer in the Department of Pediatrics, College of Medicine, University of Ibadan, and also a consultant pediatrician at the University College Hospital, Ibadan, Nigeria. So I treat patients with blood disorders and cancer. So I'm in the division of hematology and oncology. In terms of my qualifications, I have my MBBS degree, and also I'm a fellow of the West African College of Physicians, the Faculty of Pediatrics. Basically, I'm here for two main aspects of work. One is sickle cell related in terms of clinical care, and also the other aspect is research. In terms of the sickle cell, we're trying to do a newborn screening for sickle cell disease or for hemoglobinopathies, as well as develop a program for comprehensive care for children with sickle cell disease. So while I was here, I visited with the Larabida Children's Hospital, which is the place where children with sickle cell disease at the University of Chicago are taken care of. I visited our clinics, and I studied their model, which is called the model for care of children with sickle cell disease. I studied the model and I learned a couple of things, how to help to improve our kind of practice back at home in Nigeria. And in terms of sickle cell, again, the research aspects, I tried to speak with the key people that are involved with the newborn screening program in Chicago. I went to the laboratory, saw the director of the laboratory. I had a telephone conference with the people coordinating the program for the state of Illinois to have some ideas about how they run their newborn screening program, to help me put in place measures to make a successful one back at home. Well, first of all, my area of interest is pediatric hematology and oncology. That's number one. Number two, sickle cell is the thrust of my work because Nigeria has the largest burden of sickle cell disease worldwide. All right, and we are not doing a lot about them in the country. So I'm trying to see what we can do. There are little effort here and there in the country, people trying to do something, but not too much has been done so far. So I'm hoping that with connecting with the people here, with the support from University of Chicago, with Fumelo Pade and her team, and I should be able to improve our care. I should also be able to advance research in sickle cell. And in terms of the cancer as well, there's not a lot going on genetics of cancer. And when you know genetics of cancer, it is inherited, and you know how to counsel parents, how to put in preventive measures, you can do a lot. And through Fumi's practice in oncology, genetics and oncology, and her link here, I think that if we are able to do some research on genetics of childhood cancer in Nigeria, we are able to follow up with families to look at mutations in families, we will be able to help families and put in some measures to prevent or do some early detection and help people with cancer. My day usually varies depending on the key activity for the day. Usually on Tuesday mornings, on Wednesday and Friday afternoons, I go to Larabida Children's Hospital to run the clinics with them and to study their medical home model for children with sickle cell disease. And then on other days, I stay in Dr. Fumelo Pade's lab, which is where I was given an office, a place to stay. And sometimes I do some laboratory work. I learn some laboratory techniques from a senior lab technologist, new admin, so wonderful and so supportive. And then I also use that office place as a base to make meetings with other researchers for collaborative work. So either I'm in the hospital or in the lab techniques, or visiting and having conferences and meetings with people to discuss research projects. Those are most of what I did. And with the shuttle, it was quite easy to shuttle between La Rabida and the University of Chicago. Some of the conferences we had done through email, some were through telephone conversations when we could not reach. It's difficult to mention just one thing as my most rewarding aspect, but there are two basic things I'm going to talk about. Number one is that during this my 4-week period there, I had to attend the American Society of Hematology conference at New Orleans, and I think that is the biggest scientific meeting I ever attended all my life. A very big meeting. They expected over 30,000 participants. All right, I'm not sure how many actually attended, but it was a very big meeting with high level of research. All right, so it was quite impressive. I learned a lot. I met a few people into research who are also willing, who have ideas, who are willing to do some form of collaboration. The other aspect here in the University of Chicago aspect is the willingness of faculty to collaborate. Met a few people who have agreed to do some collaborative work with me, and we are hoping that in the next few weeks we will do something more concrete, and that is, I think, quite rewarding. I'm hoping it should be a long-standing and a sustained relationship that will improve my career in research, and then translate also to improve research in my institution back at home, and ultimately to improved care of patients. In terms of challenging, I'm not quite sure of what I would call challenging aspects. The issues here were that I had decided to come for 4 weeks, and it looks like all I was to achieve, it was difficult to achieve everything within 4 weeks. The time was quite short. I had to meet people that I needed to discuss research with, and people are busy. Their schedules are tight. So it's not as if you can come within a day and get an appointment with 3 people within 1 day. So I had to keep on scheduling appointments. They are all very senior people. They had to reschedule appointments. So I had useful meetings, but we could not have as many meetings to fine-tune things to the extent I would have desired, because we didn't have enough time. Part of the issue that made the time so constrained was, one, the annual American Thanksgiving, which came in during my stay here. Everybody had to go home and travel, so we didn't have much activity. And then my 1 week away to the ASH meeting. All right, so that was the main issue. And then the cold. The cold is a challenge, but I think it's part of life, and I'm adequately prepared for it. My advice I would give my colleagues is, one, they should be open-minded, because the facilities and circumstances available here are so different from what is at home. They should not be narrow-minded and have so they should be open-minded. One, two, they should have a focus. If you don't have a focus, you can come and spend 1 week, 1 month, 2 months, and you may achieve nothing. All right, people are out there who are willing to assist, but they will not give you if you don't ask. If you don't show interest, they will not break into your sphere. All right, so there are people who are willing to assist, to help with research, with training, to give information, but one must have clear-cut objectives, specific targets of research or whatever aspects of training one is interested in, and then ask the PI of this project, Fumi Olopade, who had the Olopades, who got this NIH grant, and through them, with your objectives, ask them to link you with the appropriate people that can help you bring your dreams to reality. But without a focus, expecting to just come here and being taught everything without having a focus, you might leave the same way you came. This experience has really affected my future interest in coding, because, one, I am more focused on certain specific aspects of research. Two, certainly is going to transform my practice. The pediatric sickle cell program which I run at the Master College Hospital in Ibadan. There are things I have learned which I'm going to put into place, and it's going to improve the program. And I'm hoping that I should be able to go to a higher level of clinical care for patients and also a higher level of research in terms of sickle cell hematologic diseases, and also in terms of I have made some more contacts here, and I think that the contacts I have made here will be instrumental in my advancing my goals in academics. Wow, I'd like to thank everyone, but I want to start with Dr. Fumi Olopade, alright, Ashola Olopade, through whom I came for this program, alright, and they've been so supportive. The whole place is just filled with people who are willing to help you, right? Inkem was always willing to answer my emails at every point in time and to give me help, alright. In the global health office here, everybody has been so fantastic. Dan has been wonderful. Everybody has been so wonderful. The staff have been so fine. In Fumi's lab, her lab manager, Lisa, she's been just fantastic. Fumi's secretary as well, Jeanette, she's fine. The staff in the lab are also been so friendly, but new, who have been my teacher, I want to say very special thanks to Paula Jordis. She has been with us in Nigeria last sometime 2011 or so, or last year. She's made Chicago so homely and so comfortable for me. Is it the cap I wear? Is it the gloves for the warm weather? Is it taking me out for dinner? Is it taking me to downtown to look at Millennium Park and all that? It's been just awesome. And Dr. Pedinti also of the Larabida Hospital has been so supportive and so helpful. All those who have shown interest and willingness to collaborate with me in research, Dr. Cunningham, Dr. Ken O'Neill, every one of them, and the chief of the department, I want to say very big thanks to Dr. David Gonzalez. But I thank you all guys. You've been just so fabulous in making this place very warm. And in spite of the winter, it's been really, really warm with you guys here. Thank you.